person's supine, and we're looking at the different mobilisation stretching we can do in this position. Yes? Mm-hmm. Okay. So bear in mind some of what you've already learned as well. In that, if you're going to stretch an area, it's quite nice to get it prepared and get it loose and ready for doing that. Stretch any limb, it's not a problem. And the little exercise we did earlier with the tissue paper is really useful for you to get the sense that actually you need to feel what you're doing. You don't grab anything. If you'd grabbed that tissue paper and yanked it, it would have just torn. So you don't grab anything, you treat everything with respect, and you bear in mind the restrictions that they have in their mobilisation anyway. So we're not aiming to force a joint beyond where it's going to go. We're aiming to, how I look at it, is persuade it, coerce. Just see where it will go and where it won't go, okay? That's how I like to look at mobilisation. So you've already done quite a lot of this kind of stuff, which is the swinging. Mm-hmm. Notice how I'm holding his hand. Now, it's a fairly firm but gentle grasp, okay? I'm not grabbing him in any way, shape or form. And what joints now does that allow me to move? Shoulder, elbow, wrist. And wrist. Okay? Because I'm holding an area to keep still so that other areas can move. Now think about that as a principle, because if you want to move areas, then you need to be not holding over a joint. If I hold over the elbow there, I can't get the elbow to move. But I might want to stabilise an area a bit more to help it move. So now I'm moving the shoulder a little more specifically. Okay, this is a lovely technique. So with this technique, I'm going to hold him quite straight, his arms straight, and just lifting up and down with the shoulder. Allowing the elbow to bend as I come back down. I'm just going to do a few things and then think about what I do. That'll probably be the easiest thing. Here I'm stretching down and through. Again, I'm supporting around that wrist a little bit, but only lightly. And the movement is to actually sit back and lean back into that. Okay? Same thing here. I'm going to lift most people are very comfortable with their arm coming up this way. Some people with shoulder problems actually have great difficulty with abduction. Have you noticed that already? Yeah? But most of the time their shoulders are very comfortable going that way. People with frozen shoulders, things like that, don't like this movement, don't like that movement. Lots of shoulder problems don't like that movement. So I tend to come through that way if I'm going to do anything. Now I'm the other side. I'm going to hold lightly just under the elbow, just under the wrist. Remember the tissue? What did we feel for?
Breaking point.
Well, we feel first of all for the point of stretch. Feel for the point of stretch and the end point of that. Okay? So there's a point where you can feel it stretch. I can feel it stretch here. And then I can feel at this point, that's actually the maximum, unless his body lets go a little bit more, and it probably will. What else could we use if we're stretching? What else might we think about? It's ever so hot in here. What else might we think about if we're stretching? What do we do when we do compressions?
Breathing.
Yeah, we might use their breath. So, take a deep breath in. And out. And he's gone again, so I'm coming in and out again. Okay? That's another way to do that. You might also want to ask the person how it feels. It's too much, too little. Right, let me think. So I've taken you through this way. I've taken you through this way. I've taken you through this way. I can also stretch this way. Watch the movement through his body, each stretch I do. Shall I do them again? Okay. Watch what happens through his body. So this way. Neck, yeah, pulling through that way. There's a direction through the whole body. This way. Look at the direction through the hips and even into that foot down the bottom there. Yeah? This way. Where am I pulling now? This is a great way to mobilise the thoracic area. Some of you like the mobilisation stuff like this. All that I'm doing now, you can add a little bit of movement into. See the movement through to that foot? Yeah? Like that? Playing with that? That way? We can go this way. We can stretch through this way. We can stretch through this way. All with that kind of awareness, yeah? Okay. So that's one. How are you doing there? You all right? Good. We've stretched the neck. We've done some stretching through. Actually, I think we have we? Stretched through the neck here. We could easily stretch here. Nice gentle stretch. Stretching here. In position. Right there. Good. A bit tight there. So the end point, hold it, see if there's anything more. I'm rushing a little bit. I'd usually do this a bit slower. We could stretch the neck forwards. Nice. Good. How about the leg? Same thing. Grasp underneath, on top. In position, pull, feel the end point. Might get them to do a breath. Pull with that. And the other one just to even them up. If you like working with the movement at the same time, you find the end point and the soft point before that. So remember the point of stretch and the end point, and you're going to just jiggle between the two. Any questions?
For the client, when you're using the arms, this was one of the questions when I pulled arms. She asked whether she should resist or go with it.
No, they're putty in your hands at this point.
But they've got a choice as well in it, I suppose.
No, you need them to be quite passive and let go.
So you want
need
them to be
to
as
actually
relaxed
let go.
as possible.
Yeah, yeah. Which is why sometimes giving them something like a breath is quite useful. There's lots of other things. This is one way to just stretch up here, but you can also take it over your own arm and do it that way. That's kind of not so great on my back. Depends. You can try different things. I'm trying to think if there's anything else I should show you. Talk to me, folks. Is that enough? Mm-hmm. Do you want more?
What about that one? Sorry, it feels funny.
Well, stop that a minute.
Is that all right?
Yeah. I don't think I was supposed to do that. So let's... I don't think I'm supposed to do that. Just lying down with that. You can do some nice hip stretching and mobilisation, which is just to work.
Could you do that with the leg over, the lower part of the leg on your shoulder as well? Lean into it.
On your shoulder here?
Yeah.
I don't think that would be easy for me. It's easier for me here. The idea is to keep the knee stable while you move the hip, actually. So you see I'm keeping the knee nice and straight wherever I go. There is lots of other stretches you can do. You know, there are other stretches you can do, but there's you know, a whole world of stretches you can do. But this is to keep the knee straight as you mobilise the hip. So I can have it quite close to me, nice little click there. It's lovely. I don't know whether I was supposed to teach you this or not. So I'm a little...
I think that's useful.
But I think what's really important is to remember these principles, which I've written on a piece of paper for you. Number one, don't grab anything. Please don't grab and expect somebody to relax. Two, you need control of that. So use your, what do you call this? What did we call this? Use your movement techniques to just make sure you have control. Sometimes you're not going to have control. Can you just stiffen for me? Sometimes you're just not, somebody doesn't want to give you control. In that case, you have to be more definite and actually consider that in your stretch, because if they're not relaxed, there's a possibility you could hurt them more. Okay, so be very gentle. So he's now causing some restriction in the shoulder for me, which is good because somebody with a shoulder issue would be like this. So I wouldn't take it as far. I'd go where they're comfortable, where the body moves. Start with where it moves and move from there. Okay? See if you can get it mobilised where they have where they're comfortable, and then move from there. And then gradually, if they let go, that's great. Okay, so don't grab. Keep your body aligned and relaxed, which I think I've shown you. You lean and sit back. Watch their breathing for any signs that anything's uncomfortable or any other non-verbal response that you might get. I know it's late. Feel for that point of resistance and then notice when there's a bit more give. Keep listening with your hands, so don't lose that connection with what's actually going on there. And I've written these out for you. Watch the connection through the body, so see the stretch through the body, see where it's restricted, because that might be the next place you go. And just be really careful with their joints. I have quite a lot of shiatsu, and it depends who does it as to how comfortable it is. Because when you're stretching, if you stretch without care, you pull on the skin and it's not pleasant. It's really not pleasant. So think about what you're trying to stretch. If I'm trying to stretch the shoulder, I might as well support at the elbow as well. Then it takes the pull out of here. Yes, I'm not going to drag on the skin so much. That's a lot. So I've shown you quite a lot. So shall we have a go? Good.